Hello and welcome back to Wally's Nursing Videos. Today we will discuss the pathology of hypertension from primary, also known as essential, to secondary. Hypertension, commonly known as high blood pressure, can be categorized into two main types: primary, essential hypertension, and secondary hypertension. Each type has distinct underlying pathophysiological mechanisms. Here's a detailed look at the pathology of both. 1. Primary essential hypertension. Primary hypertension, also known as essential hypertension, is the most common form of high blood pressure and has no identifiable secondary cause. The pathology of primary hypertension involves a complex interplay of genetic, environmental, and physiological factors. Genetic factors. Genetic predisposition. Genetic variations can affect blood pressure regulation, including genes involved in the renin-angiotensin-aldosterone system, RAS, sodium handling, and vascular tone. Family history. A family history of hypertension increases the risk, suggesting a hereditary component. Environmental and lifestyle factors. Diet. High salt intake can lead to fluid retention and increased blood pressure. Low potassium intake can exacerbate the effects of sodium. Obesity. Excess body fat, particularly abdominal fat, can increase blood pressure through mechanisms such as increased vascular resistance and activation of the RAS. Physical inactivity. Lack of exercise is associated with higher blood pressure due to factors like weight gain and impaired vascular function. Alcohol and smoking. Chronic alcohol consumption and smoking can elevate blood pressure through various mechanisms, including endothelial dysfunction and increased sympathetic nervous system activity. Physiological mechanisms. Increased cardiac output. Elevated cardiac output can result from increased blood volume or enhanced contractility of the heart. Increased peripheral resistance. Constriction of peripheral blood vessels due to factors like increased vascular tone or altered structure of blood vessels contributes to higher blood pressure. Renin-angiotensin-aldosterone system, RAS. Overactivity of RAS can lead to increased vasoconstriction and sodium retention. Elevated angiotensin II levels can cause vasoconstriction and stimulate aldosterone release, leading to sodium and water retention. Endothelial dysfunction. Impaired endothelial function can reduce the production of vasodilators like nitric oxide, leading to increased vascular resistance. Sympathetic nervous system activity. Increased sympathetic nervous system activity can enhance heart rate and vascular tone, contributing to elevated blood pressure. 2. Secondary hypertension. Secondary hypertension is high blood pressure that results from an identifiable underlying condition. It accounts for a smaller proportion of hypertension cases, but is crucial to diagnose and treat appropriately. The pathology of secondary hypertension depends on the specific underlying condition. Renal hypertension, chronic kidney disease, CKD. Impaired kidney function can lead to fluid and sodium retention, increased blood volume, and consequently elevated blood pressure. Renal artery stenosis. Narrowing of the renal artery reduces blood flow to the kidneys, triggering the RAS and increasing blood pressure. Endocrine disorders. Primary hyperaldosteronism, Conn's syndrome. Excessive production of aldosterone from the adrenal glands causes sodium retention, potassium loss, and increased blood pressure. Cushing's syndrome. Excessive cortisol levels from the adrenal glands can cause sodium retention and increased blood pressure. Pheochromocytoma, a tumor of the adrenal medulla that secretes catecholamines, for example, adrenaline, leading to episodic or persistent hypertension. Thyroid disorders. Both hyperthyroidism and hypothyroidism can influence blood pressure regulation. Cardiovascular conditions. Coarctation of the aorta. A congenital narrowing of the aorta increases blood pressure upstream of the constriction. Medications and drugs. Drug-induced hypertension. Certain medications, including nonsteroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and some oral contraceptives, can elevate blood pressure. Pregnancy-related hypertension. Preeclampsia. Characterized by high blood pressure and often proteinuria during pregnancy, potentially leading to serious complications for both mother and baby. Obstructive sleep apnea. Sleep apnea. Repeated episodes of airway obstruction during sleep can cause intermittent drops in oxygen levels and increase sympathetic nervous system activity, leading to elevated blood pressure. Diagnosis and management. The diagnosis of hypertension, whether primary or secondary, involves measuring blood pressure, assessing risk factors, and identifying any underlying causes, especially in secondary hypertension. Management strategies include lifestyle modifications, diet, exercise, weight management, pharmacotherapy, antihypertensives, and addressing any underlying conditions or contributing factors in secondary hypertension. In summary, primary hypertension is a multifactorial condition with genetic, environmental, and physiological components leading to sustained high blood pressure. Secondary hypertension results from identifiable conditions or factors that disrupt normal blood pressure regulation, and effective management often involves treating the underlying cause.